Welcome! This video is part of a series about clinical trials at UCSF. The topic of this video is Understanding Routine Cost in Clinical Trials. The terms routine cost and standard of care can be a confusing part of the coverage analysis process, so it is important that they are defined correctly. PIs and CRCs should feel confident about clinical trial billing and study startup procedures so they can focus on conducting research. The purpose of this video is to help create a common language so PIs and CRCs can more easily communicate with the Office of Clinical Research, or OCR, team. Clarify the way we think of routine costs here at UCSF. Let's talk about the benefits of using a common language between PIs, CRCs, and the OCR team. By all using the same terminology for the clinical trial startup process, we reduce study startup time, as there will be less clarification needed and therefore less back and forth between the study team, the OCR, and the sponsor. Reduce risks to the institution and PI by ensuring items and services are appropriately billed to third-party payers. Reduce frustration. Increase efficiency in getting to our common goal of enabling and supporting meaningful trials at UCSF by freeing up PIs and study teams to focus on their research, not the details of federal billing guidelines. Help all parties understand what can and cannot be billed to Medicare and why, thereby supporting effective negotiations and budgeting. It's time for a quick quiz. True or false? Medicare pays for standard of care during research studies. False. Medicare pays for routine costs during a qualifying clinical trial. In fact, the Medicare billing regulations do not even use the term standard of care. This is why clarifying the terms standard of care and routine cost is so important. Many PIs define standard of care as a diagnostic and treatment process that a physician should follow for a certain type of patient, illness, or clinical circumstance. While this definition is useful in the clinical setting, standard of care is not synonymous with billable in a clinical trial. Just because an item or service is considered standard of care from a clinical standpoint does not mean that it is a billable service during a clinical trial. Routine cost is not synonymous with standard of care. Sometimes they are less than the standard of care, and sometimes they are more than the standard of care. Routine cost is a regulatory term that does not question the physician's medical judgment. During a qualifying clinical trial, Medicare covers routine costs. The regulations explain routine costs to be 1. Items and services that are conventional care. 2. Items and services to diagnose or prevent complications. 3. The administration of an investigational item. Essentially, routine costs are items and services that are provided for the clinical management of the patient enrolled in the study. If an item or service is for research purposes only, then it will not be a routine cost and will not be billable. An item or service will be considered a routine cost if it is conventional care for the patient's treatment, it is being provided for the detection or prevention of complications, or it is for the administration of the study item or service. It is important to remember that for any items or services required by the protocol to be billed to Medicare, the research study must first qualify for coverage. If the research study does not qualify for coverage, then even items and services that are medically necessary will not be covered. Medicare uses the term qualifying clinical trial to describe a research study that qualifies for coverage. If the research study as a whole does not qualify for coverage, then no services are billable. The OCR analysts determine if your study is a qualifying clinical trial during the coverage analysis process. The method of determining whether a research study is a qualifying clinical trial is outlined in detail in another video. We are emphasizing the differences between these terms because of the harsh penalties that can come with research billing being non-compliant. The False Claims Act enables the federal government to penalize institutions and providers for incorrect billing during a clinical trial. An important step toward 100% research billing compliance involves getting PIs, study teams, and OCR all on the same page and speaking the same language. Because the billing regulations can be difficult to understand, UCSF and the OCR team are improving processes to make the coverage analysis process smoother and more transparent for PIs, and study teams. We want PIs and study teams not to worry about the minutiae of billing and focus on what is truly important: conducting impactful research.